Overdose deaths are up in our region despite being down across the rest of Tennessee. Thanks for joining us. I'm Sarah Diamond. Casey Marler has the night off. Across the state, just over 3,600 people died of overdoses in 2023. It was down 5.5% from the more than 3,800 reported in 2022. The State Department of Health says that was the first year-to-year drop since they began monitoring the data in 2013. On a national level, the Centers for Disease Control says overdose deaths also dropped from 2022 to 2023, going from nearly 108,000 to just over 105,000. News Channel 11's Brody Wilson met with local addiction experts to learn why our region did not see a drop like other parts of the state and country. Brody?
Yeah, Sarah, the latest Tennessee Department of Health data shows drug overdoses claimed 270 lives in Northeast Tennessee in 2023, a 2.3% increase from the year before, despite the first statewide decrease in years. The increase of 6 from 264 in 2022 was entirely due to Sullivan and Greene counties, where overdose deaths rose by 16 and 9 respectively. Deaths decreased in Carter, Hawkins, Johnson, Unicoi, and Washington counties. ETSU Addiction Science Center co-director Angela Hageman says that could be for a multitude of reasons.
Everything from changes in supply. I know we're seeing a good bit of xylazine showing up, and we're not testing for that maybe in the same ways yet, or our testing capabilities haven't maybe caught up to new trends in the drug supply.
The new figures show East Tennessee with the highest overdose death rate of any of the state's 3 grand divisions, more than 40% higher than either Middle or West Tennessee. Hageman says despite the uptick in the 2023 data, the area is still trending in the right direction.
10 to 15% across the nation, so they are dramatically going down. And the spike in overdoses were related to fentanyl. So keep doing what we're doing, continue to pay attention to the supply side and the demand side, and be on the lookout for new problems, new supply, new drugs.
Craig Forrester is the program director at Recovery Resources. He says it'll take the entire healthcare community coming together to fix the drug problem in our region.
What's going to save our community is if we all come together and we say, hey, I know you do this really well. I believe we do this really well. How can we work together to best serve the people so that the numbers will decrease? Right. And my hope is, and my belief is, when this time next year, they 2024 numbers, I believe you will see a decrease in especially the fatal overdoses in our region.
Hageman told me that based on hospital and other data, she believes the number of deaths related to fentanyl use was down in 2024 and will drop even more in 2025.